Hi everyone, my name's Hilton Menz and I'm Professor at NHMRC Senior Research Fellow at La Trobe University in Melbourne. And the title of my presentation today is What Type of Patients Do General Practitioners Refer to Podiatrists? And before I start, I'd just like to acknowledge my two co-authors on this project, Dr. Chris Harrison and Dr. Claire Bayram, who are both from the School of Public Health in the Faculty of Medicine and Health at the University of Sydney. I'd also like to acknowledge that during the course of the study, funding was received from a range of organisations shown on this slide, but none of these organisations played any role in the conceptualisation of the study or its conduct. Now, by way of introduction, in many countries around the world, including Australia, GPs play a major gatekeeper role in healthcare. Now, the introduction of Medicare funding in 2004 did facilitate GP referrals to podiatry through the Chronic Disease Management Program, and we have seen very high rates of podiatry utilisation under this program. But we don't know much about the patterns of referral by GPs, so the objectives of this study were to determine whether referrals have actually increased over time as a result of that funding change, and also to examine what types of GPs refer to podiatrists and what types of patients do they actually refer. So this study used data from the Bettering the Evaluation and Care of Health study, better known as the BEACH study, which was conducted by the University of Sydney. Now this is a continuous cross-sectional survey of GP activity, and the way it works is that they randomly sampled 1,000 GPs every year and asked them to consecutively document 100 patient encounters in quite a lot of detail. So the database has a lot of detail about the GPs themselves, as well as a lot of detail about the patients. Now for this study, we examined data from April 2000 to March 2016, because this encompasses the time at which the Medicare funding was introduced in 2004. So we can look at GP activity before and after the introduction of that program. Now, the data set that we extracted included 1.56 million GP encounters, and within that there was 5,192 podiatry referrals. Okay, now before we move on to the results, just a few points about the analysis approach. Now, BEACH has a single stage cluster sample study design, and that means that the GP is the sampling unit and the GP patient encounter is the unit of inference. So in order to adjust for that clustering, we use the survey means procedure in SAS version 9.4. The second point is that statistical significance in this study was determined by non-overlapping 95% confidence intervals, which is a slightly more conservative technique. Thirdly, the referral rate was calculated by extrapolating GP referrals to non-referred MBS GP attendances claimed each year, divided by the annual population. And then finally, in this presentation, just because of the time constraints, I'm only going to be talking about the univariate analysis, but we did also perform a multivariate analysis, which you can find in the main manuscript. This chart shows the GP referrals to podiatrists between 2000 and 2016 expressed per 1,000 encounters, which is the solid blue line, as well as per 1,000 population, which is the dotted blue line. And as you can see, between 2000 and 2004, it was fairly stable. However, after the introduction of the Medicare Chronic Disease Management Program in 2004, you can see there is a really large increase in the number of referrals to podiatrists. In fact, the rate increased fivefold from 2004. This slide provides some information about the patterns of referral using regression analysis. In univariate analyses, GPs who referred to podiatrists were more likely to be female, aged 45 to 54, or working in inner regional areas. Patients were more likely to be referred to podiatrists if they were female, aged more than 45 years, if they held a healthcare concession card, were socioeconomically disadvantaged, or if they'd previously been seen at the practice. This slide shows the rate of podiatry referral according to patient age, expressed as a rate per 1,000 encounters. And as you can see, there's a very, very clear association with age, with by far the highest rate of referral recorded in those aged over 85. This chart shows the problems most frequently managed with GP referral, and you can see by far the most common problem managed was diabetes, followed by soft tissue disorders, so bursitis, tendinitis, synovitis, administrative procedures, so that's largely the development of care plans, foot or toe symptoms, corns and calluses, acquired limb deformity, osteoarthritis, referral to another healthcare professional, ingrown toenails, and other nail complaints. This slide compares the characteristics of patients before and after the introduction of Medicare funding. So compared to referral characteristics prior to 2004, following the introduction of Medicare funding, patients referred to podiatrists were more likely to be female, be aged 45 years and older, have a healthcare concession card, be socioeconomically disadvantaged, have diabetes, and have previously been seen at the practice. So in summary, this is the largest analysis of GP referral patterns to podiatrists that's been conducted in Australia. And what we've shown is that there has been a marked increase in the number of GP referrals to podiatrists following the introduction of the Medicare Chronic Disease Management Program. Interestingly, when we look at GP characteristics, we see that younger and female GPs are more likely to refer to podiatrists than older or male GPs. So this might be something we need to keep in mind in terms of promoting the value of podiatrists to different GP groups. If we look at the patient characteristics, I think it's fair to say that the referrals have been targeted to those most in need. So older people, those who are socioeconomically disadvantaged, and those who have diabetes. Having said that, we don't really know what happened as a result of these referrals, and we don't have any data on these people after they've received their podiatry treatments. So we need further research to show that there's been some improvement in health status in people who are referred to podiatrists by general practitioners in Australia. If you're interested in reading about this study in more detail, a paper based on this analysis was published in the journal Public Health earlier this year, and I've provided the reference details on the slide.